Antabuse, a bitter pill to swallow. In our current society, 75 million people have alcohol use disorders. People who are alcoholic often have problems including physiological, behavioural and social issues, meaning that often they are unable to fulfil home and work responsibilities and sometimes put themselves and those around them in dangerous situations. A range of pharmaceutical interventions have been developed to address alcohol-related problems. In the forefront of these options is Antabuse, otherwise known as disulfiram. Antabuse is a behavioural intervention used for the management of alcoholics who want to stay sober. Alcoholics can get Antabuse via a prescription from a doctor and take 1 pill per day for the duration of their treatment. Antabuse can help with abstinence from alcohol, but it is not a cure for alcoholism. So, how does Antabuse work? When we drink alcohol, it gets processed and broken down by the liver. The alcohol we drink, ethanol, gets converted to acetaldehyde by the enzyme alcohol dehydrogenase. Acetaldehyde then gets converted to acetic acid by the enzyme aldehyde dehydrogenase. When a patient takes Antabuse, it inhibits the liver enzyme aldehyde dehydrogenase, which stops acetaldehyde from being converted. This increases acetaldehyde in the body, resulting in a disulfiram ethanol reaction. The disulfiram ethanol reaction results in hangover symptoms such as facial flushing, nausea, a throbbing headache, vertigo, sweating, palpitations, hypertension, and chest pain. This intense reaction encourages conscious decision to stop drinking and promotes positive psychological change in patients. However, very rarely, Antabuse causes a severe reaction, leading to hepatotoxicity and sometimes death. Other pharmaceutical options for alcohol use disorders include options for alcohol withdrawal, such as the drugs diazepam and thiamine. It also includes options for drugs similar to Antabuse that help with abstinence from alcohol. These are drugs like acamprosate and naltrexone. Acamprosate, solacampril, is an NMDA receptor blocker antagonist. Acamprosate works by restoring the chemical imbalance in the brain caused by long-term drinking. It enhances GABA reception and transmission and thereby helps reduce cravings for alcohol. Naltrexone, so does Revere, also reduces cravings for alcohol and makes drinking feel less pleasurable. Naltrexone is a pure opioid antagonist. It blocks the effects of alcohol on opioid receptors, which has an effect on our mood. In comparison to acamprosate and naltrexone, Antabuse has a much greater effect on patients. It has a better effect on abstinence, has an increased number of days before relapse, and an increased number of total alcohol-free days in patients. However, it does have some disadvantages. It has a chance of causing a severe adverse reaction, as mentioned previously, and cannot be used with a number of medical conditions, such as hepatic or renal impairment, cerebrovascular disease, or pregnancy. It also requires patients to be willing to take the medication and on a daily basis. The future of Antabuse. Despite its disadvantages, Antabuse is currently still a drug of choice, as it is still of great benefit to many patients. However, in the future we need to look at treatments that use combination therapies or develop new drugs that affect underlying alcohol dependence, rather than relying on drugs that treat cravings and behavioural intervention.